Hey, I'm Dr. Jeff Smith, author of the book Living Pain-Free, It's Your Choice. That means I literally wrote the book on ending your chronic condition. We're here today to talk about vertigo, dizziness, and balance problems. Now, if you're watching this video for yourself or for someone else, you need to listen very carefully. We have a solution to those problems. We treat our patients metabolically and neurologically to rid them of their condition. If you're still taking pills and medications for those conditions, vertigo, dizziness, and balance problems, your problem's not being fixed. It's being coddled. Those medications cannot fix the problem. We can. Let me tell you how we do it. How do we finally end your chronic condition? What makes us different from other doctors? Well, we treat metabolically and neurologically. Now, what does that mean, metabolically and neurologically? Well, metabolically means that we're going to run specific tests of blood, urine, saliva to see what's going on inside of you. Okay? No stone is left unturned so we can determine the exact cause of your condition. I'm not interested in the symptoms. I'm interested in why you have the symptoms in the first place. Metabolic treatments are based on specific lab tests. So we run tests. For instance, we run a thyroid panel. We run a complete metabolic panel. Okay? We also run a lipid panel and a CBC with autodifferential. Now I know I've heard it many times before. Doctor, I've had all the tests. My doctor said they're normal. Well, why are you still sick? Why are you watching this video if you're normal? If your blood tests are normal, you shouldn't have to watch this video. Let me tell you why you're not normal. Your laboratory tests have a column on the right side that says what normal is. What they don't tell you is what functional normal is. Another word would be optimal. What is the optimal range? Well, if you have vertigo, dizziness, or balance problems, you better darn well know what's optimal for you, not what is normal for the whole population, right? We need to look at those things. We run sensitivity testing on our patients. What is sensitivity testing? Well, we test to see if you have any sensitivity to food items like wheat, gluten, soy, milk, eggs, or yeast. Because if you do have sensitivity to those things, and you put them in your body when you eat, it's going to cause inflammation in the body and in the brain. And if you have inflammation in the brain and you have vertigo, dizziness, or balance problems, guess what? You're going to have more of those problems. Okay? Or it could be the cause of the problems. Now, some of the other symptoms of just being sensitive to those things, gluten, soy, yeast, and milk, chronic pain or fatigue, if you have that, along with the dizziness, vertigo, and balance, okay? Frequent indigestion or feeling of bloatiness right after you eat. You just feel gross, okay? Frequent loose bowel movements, or the opposite of that, which is chronic constipation. Or maybe you have sores or ulcers in your mouth or vomit. All those things are associated with simple sensitivities to certain types of foods. And if your doctor doesn't order those tests, you're never going to know why. You're never going to know why you have balance problems or dizziness or vertigo. Okay? Adrenal stress index. Why is that important? Well, if your adrenal glands don't work, it can't regulate your blood pressure. It can't regulate the amount of stress you have in your body. It's going to cause your brain to malfunction and cause more dizziness and balance problems. It's a simple test that tells us what level of cortisol you have in your body. That tells us why you have the problem in the first place. Without that test, no solution. Autoimmune disorder. Why would an autoimmune disorder be a potential problem for you? Well, let me put it this way. If your body is autoimmune, or it's eating away at its own tissue, let's say your immune system is out of whack and it's attacking your lower brainstem. Guess what happens? You can't stand still. Because your brainstem, or more specifically the cerebellum, is responsible for all movement from your eyes down. The way to know if you have a balance, vertigo, or dizziness problem and whether or not it's related to your brain is to put your feet together, stand up nice and tall, and look straight ahead at an object and focus on it. And then when you close your eyes, if you cannot stand still with your eyes closed, it's not an inner ear problem. It's not a sinus problem. It's a brain problem. And that's why you have balance, dizziness, or vertigo problems. It's your brain, not your ears. Okay? Immune panels. That's what tells us if your immune system is attacking your own brain. There are certain tests we need. Lymphocyte subpopulation, Th1 and Th2 cytokine panels, natural killer cell activity panels, or your body's natural defense panels. If your doctor doesn't order those tests, he's not going to know, or she's not going to know, how your immune system is working or not working, or why it might be attacking your own body. Those tests show that answer. They give us that information. We also check the gut, or the bacteria in the gut, because if you overproduce the bad bacteria, which is called Helicobacter pylori, or H. pylori, it causes your gut to leak. Now, leaky gut means that the toxins and the stuff that's in your bowels leaks out into your body cavity, kind of like when your appendix bursts. How does that affect your balance problem or your dizziness? Well, if you get an infection throughout your body, your brain's going to swell up, and it's going to put more pressure on the brainstem and cause you to have even more balance problems. Okay? It's a simple test. Neurotransmitters. Why are neurotransmitters important? Well, if you don't have enough of them, your brain can't communicate with your body at all. That's a simple test your doctor needs to know how to run. Hormones, male and female, testosterone levels, vastly affect dizziness, balance, and vertigo problems. And if your doctor hasn't tested them, they're not going to be able to help you. Not going to be able to help you. Inflammation. C-reactive protein. It's a protein in the brain, and if it's in too high of an amount, it means your brain is swelling up. You know what happens when your brain swells? Well, number one, balance, vertigo, and dizziness. But the second thing is it can kill you. I think I'd want to know that. Glutathione. Glutathione is the mother lode of antioxidants in your body. If you don't have enough of it in your bloodstream, you're not going to be able to fight off anything wrong inside of you. Okay? Cancer comes from that. Those tests tell us exactly what we need to know about the balance, vertigo, and dizziness problems. And without those proper tests, you are never, ever, ever going to get over your condition. Never. No matter how many pills they give you, you won't get over it. How do we treat the condition? Well, we treat it neurologically. We use brain-based therapy, or we treat the brain. How do you treat the brain? Well, we're going to use concentrated oxygen. Oxygen heals. If you have parts of the brain that are damaged, and we run our tests and figure out what parts are damaged, we can treat those parts of the brain with concentrated oxygen. Proper glucose. Your body needs proper fuel. If you don't give it the right kind of fuel, it's not going to work right. Okay? Activation. Your brain needs activation. It needs stimulation. If parts of your brain, like the lower brainstem, aren't working, and we need it to work better, we need to activate it. We use things like spinal decompression, laser therapy, adjunctive therapies, physical therapies, things of that nature to wake up or treat or activate parts of the brain that aren't functioning. Sometimes we even use interactive metronome to get the brain working from left to right properly. It's kind of like your car engine. There's a right and a left side to your brain, just like there's a right and a left cylinders in your car. If the 4 cylinders on the right are going down the road at 3,000 RPMs and the 4 on the left at 1,200, your car ain't going to work. Well, if the right side of your brain's going 3,000 and the left 1,200, your body ain't going to work. Okay? We have to treat it that way. Ask yourself the 4 following questions. Okay? Number 1, how has your chronic balance, vertigo, and dizziness affected your job, your relationships, your family, your time, your happiness? What does it cost you in terms of money or time or sleep or worry or stress? What does it cost you? Number 3, where do you picture yourself in 1 to 3 years if this condition keeps getting worse because you're not taking care of it or your doctor's not fixing it? Where do you see yourself? And number 4, what is it worth to you if someone could actually rid you of that problem? Is it worth your time? Is it worth your effort? Is it worth doing things the doctor asks you to do? If you can't answer those 4 questions, then don't call me. We can't help you. Okay? If you're serious about this, and if you're serious about finally getting over this condition, give us a call, 271-6992. If you're not serious, if you don't want to put in the time, if you don't want to do what the doctor asked you to do, if you're not willing to have the proper tests run, keep taking your pills. Keep getting worse. That's fine. We treated out of this clinic last year 18,203 patients. I simply don't have time to accept every patient that walks through my doors. So if you're not a candidate for my program, then keep taking your pills. Stay on that path. But if you're a good candidate, if you come in and we run our 4 screening tests on you and it says you're a wonderful candidate, we literally can change your life. Visit our website, www.thechronicpainclinic.com, and you can listen to some of our other patients that have suffered from this condition that we have helped change their life. You can read what they had to say, you can listen to them on video, you can actually read about them in this book, the book I wrote. Their stories are in here as well. If you call our office and make an appointment, we'll also send you a free DVD. This DVD that you watch will tell you exactly why and how and what we need to do about treating your chronic balance, dizziness, and vertigo problem. It'll give you some insight on what to ask me when you come in. If you have old blood work that your doctor's taken, bring it with you. If you have old MRIs or old x-rays, bring them with you. I need to see them. It'll help me determine your success rate for treatment, which we want to have at 100%, or we simply won't accept you as a patient. Again, visit our website, www.thechronicpainclinic.com. Call our office, 271-6992. If you're ready to change your life, if you're ready to end your condition, give me a call. I'm Dr. Jeff Smith. I look forward to seeing you in the future. Have a blessed day.
How many years did you have the problem?
I'd say 25 or more.
25 or more. Was it something that you had tried other things and treatments and medications and other things for with doctors?
Yes.
It's probably some degree of success, but it always hung around?
Right.
That type of thing? Okay.
I had lots of bursitis problems in my elbows and so forth, and the shots for that did not work.
None of that worked? Okay.
No.
You also had fatigue issues, sleeping issues. That's pretty typical with fibromyalgia patients that we see. So we examined you and determined you were a good candidate for our fibromyalgia program for brain-based therapy. We put you through the program. You're actually getting re-examined today. Things are going really well?
They are.
Okay. What have you experienced as a good benefit, I guess, from going through our program so far?
I don't have hardly any pain at all anymore in my muscles.
You don't ache when you get up, that kind of thing? Sleeping better?
I feel more rested when I wake up.
Are you able to do things outside of the home before you go without having to think about them before you do them?
Yes.
A lot of patients that have fibro, that's the main thing. They gotta plan out their day ahead of time because they,
Oh, yes.
you know, if not, when you reach that limit, when you've gone too much, you have that fibro fog and you crash. So you're able to do that now. Great. Well, we're getting ready to.
If you're sick of having pain and sick of living on pain pills, you can come see Jeff Smith at Smith Chiropractic Clinic. I called him up and made an appointment. Jeff took a couple of x-rays of me and studied my case. It was the most professional operation I'd ever seen. The place is wonderful, and I can't say enough good things about it. I don't know what I'd do without it.
We will design a wellness plan that's right for you. Call us today for an appointment.